Good morning, good afternoon, and thank you very much for joining our healthcare security webinar on moving beyond security to deliver a better patient experience. My name is Derek Arcuri, and I'm the team lead of the industry and application marketing practice, and I'm joined by Tom Morgan. He's the Director of Business Development for Healthcare at ASSA ABLOY. So before commencing the webinar, I'd like to quickly walk through the agenda and some logistics as well. First, we're going to start by discussing how the healthcare environment is evolving. We'll discuss how security can improve overall safety and compliance by adopting greater automation. We'll then shift gears and talk about safeguarding your system to protect the privacy of patients and staff, and finally end off today's session on understanding the mobility of people, both staff and patients and staff, in order to guide facility planning. At any time throughout the webinar, please feel free to submit your questions using the question dialog box located or signaled here in blue. We have some individuals that are currently monitoring for questions. We can respond to them in real time, and we'll also have a brief questions and answer period following the webinar. Also, note that you're able to download the handout. Actually, the handout isn't available. They were sent by email. We'll ensure that the presentation material is shared with you along with the video recording after today's webinar. So if there are key themes to walk away with from today's presentation, it's that traditional security systems solve traditional problems, and that your security team could play a broader role in reducing staff stress levels, improving patient safety and compliance, and that we could help you use your security technology to have an impact in overall healthcare quality. So I'd first like to start off by asking a question to the audience about what does your security system, or what do your security systems help you accomplish in your day-to-day? And as you're thinking through that, I said about protecting patients and staff, to helping keep the bad guys out and the good ones in, helping detect threats, helping with investigations. But these are all very traditional problems solved by traditional systems. You see, traditional systems solve traditional problems. They enroll cardholders, they control access, they lock doors, they record cameras, they run analytics, they stream video, they detect vehicles, they capture license plates, they locate patients and assets and pinpoint their location. They monitor events, manage alarms, evidence, and records. But they're all disconnected, and they're not tailored specifically for your healthcare environment. Each are designed for a single purpose. But overall, your needs are evolving. Demographic changes is a defining issue of our time. As the population, the worldwide population ages, the healthcare systems of every country, including that of the US and Canada, are facing significant challenges to meet the needs of aging population. For example, in the United States, the number of Americans over the age of 65 is expected to double from roughly 50 million today to nearly 100 million by 2060. That's according to Forbes. So what worked for us in the past may no longer work for us as the population ages. Hiring more staff and increasing real estate should not be the only option. So the question I have for you today is, are you automating your processes to ensure that staff aren't overloaded to keep pace with the aging baby boomers? Additionally, the threat landscape is evolving. The threats that we see today are not nearly the same of what we've seen just a few years ago. In November of 2018, the computer system of the East Ohio Regional Hospital and the Ohio Valley Medical Center suddenly stopped working. They'd been hit by a ransomware attack, forcing the hospitals to divert patients from the emergency rooms and return to a paper charting system. Staff had trouble accessing bedside ultrasounds and had limited access to CT scans. Now, the 2017 WannaCry cyber attack infected thousands of hospital computers around the world and threw the United Kingdom's National Health Service into chaos, costing them £92 million. Now, this forced doctors to ferry lab results across hospitals by hand and cancel nearly 20,000 patient appointments. The attack targeted vulnerabilities in the Microsoft Windows operating system, encrypting data and holding computer systems for Bitcoin ransom. So all this to say is that the threat landscape today has evolved in sophistication, but the question I have is, are legacy systems up for the challenge? And are you working with trusted partners to guide you to reduce your overall risk? And another way that your needs are evolving is that the aging population and changes in insurance coverage really affect the utilization of hospital spaces. And as a result, your healthcare environment is continuously adapting. But how do planning, design, and construction teams decide where and how to make improvements? And are these teams tapping into the right data to guide their planning? And are you using your security system to its potential? So despite these trends that we're seeing in our market, your security system should be able to help you do more for your healthcare facility. Your security system can play a broader role, your security team rather, can play a broader role in the overall healthcare quality that you're providing for patients. To move beyond security to improving safety of patients and staff, to help maintain compliance with healthcare regulations, to protect the privacy of patients and staff, to improve the resilience to cyber threats, and ultimately improve facility planning so that patients and staff flow through the campus more efficiently. And if this is your vision for security, we can help you get there. But embracing a broader vision for security is challenging if you're still integrating distinct security applications that were never designed to work together. Integrating systems that aren't operable is complex and limited because of deployment and maintenance costs of incompatibility with recent upgrades. Upgrading one system breaks the integration with other systems, and integrating systems are not always the answer, but rather migrating to a unified and open and scalable security platform that can give you the freedom to choose the hardware and migrate away from closed solutions and effectively plan for future growth. You protect your hardware investments against proprietary system shortfalls and minimize your overall total cost of ownership. And in doing so, you're effectively empowering your operators with the tools and data needed to respond to threats and make more informed decisions, all the while securing your data and privacy. So what's the difference between integrating two existing systems or more existing systems versus migrating to a unified security strategy? So there are stark differences between our vision for security and that of the rest of the market. Integration is simply not the same as unification. Integration requires you to work with multiple systems, brings together systems that were never really designed to work together, and as a result limits your freedom to upgrade. You ultimately miss out on long-term productivity and efficiency gains. Whereas unification, on the other hand, allows you to manage everything from one application, thus addressing multiple needs, delivers a consistent experience. So you benefit from savings in training, infrastructure, and life cycle management. Now, I'd like for you all to participate in a poll, a live poll here available with GoToWebinar. The question that I have for you is, how many independent applications are you currently managing in your healthcare environment? And the possible responses are only one security application, between 2 and 5, between 6 and 10, between 11 and 15, and then more than 16 security applications. So feel free to take a second to respond to the poll. Think of all of the different security applications from access control systems to automatic license plate recognition to intrusion to intercom and so on. How many systems are you currently managing? And it looks like the overwhelming response here from participants is, in fact, 78% of, well, now 67% of respondents say that there are between 2 and 5 security applications to manage. So it shows that there's quite a bit of different user interfaces for security teams to consume that can be a challenge for many. So I'm going to go ahead and close that poll now and move on. So finding efficient ways to improve safety, comply with regulations, improve planning decisions, and improving healthcare quality is obviously the end game here. But before getting there, there's a quick detour that you should consider, and that is to unify your security system to working with one pane of glass as opposed to 2 to 5 different systems that were never designed to work together. And that's not just at the client level, but also at the platform level. And that will ultimately help improve operator efficiency. That will then give your teams the bandwidth to take on a broader vision for security, a vision that helps with improving overall healthcare quality. Now, taking that vision to light, let's first discuss our first pillar of today's presentation. That's about improving safety and compliance with a unified security platform. So there are 3 core inputs that you have access to in order to improve safety and ensure compliance. The first one is people. As a healthcare utilization increases, you can hire more staff to ensure employees are working in a safe manner that is compliant with your policies. The second is the increase of processes that guide employees towards safe work practices. And the third is a use of technology to help improve overall automation. The key is finding and maintaining a balance. Technology can help automate and reduce the staff, or the burden rather, on staff. Allow me to illustrate this with a big problem we're seeing in the industry, and that's drug diversion. It's a transfer of prescription drugs from a lawful to an unlawful channel of distribution or use. And it's a significant problem that has a direct impact on drug spend. The estimated cost of controlled prescription drug diversion and abuse to both public and private medical insurers is approximately $72.5 billion a year. And among healthcare providers, it's estimated that 15% of pharmacists, 10% of nurses, and 8% of physicians are challenged with alcohol and/or drug dependency. So to illustrate the effects of drug diversion, I'd like to tell you a story. Lauren Lulini from Denver went in with a routine, or rather a kidney stone surgery, and came out with hepatitis C. The surgical assistant named Kirsten Parker, shown in the smaller window here, who is addicted to opioids, injected the fentanyl that was intended for Lauren into her own arm and then refilled that same syringe with saline. The nurse stole the pain medication and infected Lauren with a deadly liver disease. Now, Kristen Parker has been doing this for months and had infected over 36 patients with hepatitis C before she was caught. In Cincinnati, there's a specialized police force that investigates drug diversion in healthcare, and they're averaging an arrest per week. And they estimate that if the rest of the U.S. was as advanced as Cincinnati at investigating drug diversion, they would arrest 102 nurses per day. So how do you prevent drug diversion? So many healthcare facilities store their narcotics in a locked drug room, many times comprised of compartments or cabinets. And this helps improve flow and access to certain drugs, but not all. Now, you can equip your staff with a self-service portal for them to place access requests by selecting the narcotic that they'd like access to, and when they require the access, and most importantly, why they require that access. The access request will automatically be routed to the right person, and that can then accept or reject the request. If accepted, the staff member can then use their existing access control credential to access the specific cabinet where the narcotics are housed. You could even enforce a 2-person rule, which means 2 people, say the employee and her supervisor, need to badge their card on the electronic lock in order for the cabinet door to open. And this makes for more accountability if there is a theft or shrink reported. Now, all access events appear in a centralized pane of view. Unified access control and video tie access control events with video cameras so that operators have more context. More importantly, reporting on these events is centralized on one platform thanks to system unification. Dashboard and reporting can help simplify investigations and improve your operations. So again, the solution isn't just people or just technology, but finding rather the right balance between people, process, and technology. Striking that balance that meets your needs is key to sustaining your drug diversion prevention plan. Another challenge affecting healthcare facilities is patient wandering. According to the Journal of American Nursing, 46% of wandering patients were found within 5 hours of them leaving their rooms. A 74-year-old male patient disconnected himself from his IV 5 hours after open heart surgery to walk out onto the porch and have a cigarette. He was later discovered 15 minutes later with significant blood loss, which eventually led to his death, but no one noticed an IV pump alarm. And that underscores the challenge that healthcare facilities face with alarms. An 86-year-old woman with a history of dementia found her way out of her room, up the stairwell, and onto the roof of the hospital. The weather was very, very hot where she was, and she eventually died of hypothermia. Now, the door to the stairwell was not on the alarm system, and so, of course, no one received that alarm. An 87-year-old dementia patient was admitted to the hospital for a gastrointestinal bleed. She wandered from her room and crawled into bed with another patient. The other patient notified the nurse, but before they can get there, the patient left and fell in the hallway, breaking her hip. The other patient sued, as well as the wandering patient's family. So given the amount of alarms that sound in your environment, how would you know which ones are genuine? And what if you can be notified when a patient left an area that they should not have left before they start to put themselves at risk? So real-time location-based services can help improve patient and staff safety, but by placing an active tag on patients and installing antennas in the wall outlets of the room. And security teams can draw geofences, like seen here, that notify relevant staff when the patient crosses that geofence. So you can equip your night shift staff with mobile panic buttons, even if a nurse feels that their safety is at risk. Now they can activate that button that is on them at all times, and ultimately that could signal to an operator that they don't feel safe. And other surrounding staff members can start recording footage with mobile devices as well and stream in real time in areas that are tough to reach. So a couple of use cases there in terms of real-time location-based services. Know in real time when staff or rather patients cross geofences set, say, in this individual's room. And if they cross that geofence when they shouldn't be, a nurse can come and rescue that patient and put them back into the area that they should be. And this would allow for means for egress for that patient, but also alert the staff member, alert the nurse when that patient leaves an area that they should not. And of course, when that patient is placed back into the right area, then the alarm is automatically acknowledged. And the same applies for a nurse that or an employee that may not feel safe around certain patients. They can always hit that panic button that is on them at all times, and that'll notify operators of what's going on. It'll find their location within the security system and find the closest camera to get more context. Now, I'd like to point out that we're currently working with our partners to put this very scenario into practice. So this functionality will be available soon. And if you'd like to have more information, please feel free to use the question dialog box to send in your questions. And we have individuals on our team within R&D that are able to respond to those questions. Now, while video surveillance hasn't always been used for direct patient monitoring and care, new innovations such as thermal technology have made it possible to use video surveillance without violating patient privacy or HIPAA regulations. It is renowned for ensuring reliable detection with a low rate of false alarms, which is key in healthcare. So it's ideal for a busy setting. Now, healthcare providers like yourselves need round-of-the-clock monitoring of patients without encroaching on their privacy. The ability for closer monitoring of patients can help staff respond to incidents much quicker, which in a hospital can sometimes be the difference between life and death. Thermal cameras can detect and measure the temperature of a target. Say the target is set at the body temperature of the patient. This means that if the patient falls, the camera will automatically detect the drop in temperature from the body temperature to a cooler temperature, which is at the bed's surface. This means that the operator doesn't have to monitor all cameras in all areas, but simply reacts to alarms generated by detecting a temperature drop or the change of temperature of that target. Now, the nurse can receive the alarms on their mobile phone and is prompted to help that patient. Security operators can concurrently receive the alarms in their GSOC or in their central monitoring station and help build a case to show how prompt staff responded to the fallen patient. And circling back to the amount of false alarms or the amount of alarms that healthcare facilities have to deal with, according to the American Association of Critical Nurse Care, 72 to 99% of all hospital alarms are false. And there's an average of 350 alarms per patient per day. There's just way too much noise for nurses to respond to. But a similar observation is being made for physical security alarms in healthcare. We recently surveyed healthcare facilities and asked them to estimate how many alarms were considered false alarms. And we learned that almost 60% of healthcare security operators claim that more than 40% of their daily security alarms are false. So I actually want to poll the audience today to get your opinion, your live opinion, in terms of how many security alarms do you estimate are false or considered nuisance alarms in your specific healthcare environment? Is it between up to 24%, more than 25%, 50% or more, 75% or more, or 90% or more? So it looks right now that out of the individuals that are submitting their polls or responding to the polls, it looks like about 33%, or the majority of the vote is about 75% or more of alarms are considered nuisance or false alarms. Okay, so I'm going to close that poll. So this really shows how challenging it is for a healthcare facility to reduce the noise and to reduce the amount of nuisance alarms in their environment. So how do you cope with nuisance alarms? And how can you reduce alarm noise? Let me illustrate this with a scenario. Now, many security teams react to, say, a door-forced open event on the floor of the maternity ward because that signals that there may be a possible infant abduction if someone is requesting egress from that area without presenting a valid credential. Now, building codes prohibit you from restricting egress in the case of, say, a fire, so someone would have to apply 5 pounds of pressure on the delayed egress crash bar for usually 15 seconds in order to open the door. Now, this signals an alarm, but also allows for delayed egress. But what ends up happening most often is that it's potentially a patient that will egress from that area for that entry without a valid credential, and that will signal an alarm that isn't genuine. And this leads to too many nuisance alarms that bombard the security team. So what if you can combine system events to trigger genuine incidents so that you can cut out the noise? So in this scenario, all infants are tagged with an RFID chip in the maternity ward. When the tag surpasses the first perimeter, an alarm is sounded, but more often than not, they're false alarms. However, when the infant tag system goes off and there is a door forced open event within 30 seconds of the previous alarm, then we can create an incident. And an infant abduction incident is something that operators should respond to. This combination of multiple events is possible with a collaborative decision management system. And this system can also guide operators through the incident to quickly neutralize that threat. So whether faced with a routine task or an unanticipated threat like an infant abduction, lack of information, human emotion, and stress levels can quickly take hold of a responder and impact their decision-making process. Between scanning multiple security applications, coordinating actions with superiors and team members, and shifting through complex paper procedures, operators can quickly feel overwhelmed. And security systems should be more than just notification tools, right? They should help personnel feel in control of situations by guiding operators through the entire life cycle of an incident, from trigger to resolution. So here's an example of a decision tree that shows codified procedures that are dynamic, which means that based on the operator's response to a question, a different path can be taken. And this type of assistance can help operators improve their time to resolution and ensure the right procedures are being followed. So I want to shift gears from talking about how unified security can help improve patient and staff safety to help ensure compliance, to talking about how you can improve your resilience and protect the privacy of patients. Now, threats are still evolving. As value continues to migrate online, digital data is becoming more pervasive and personal. The surface of attack continues to expand and new vulnerabilities are introduced. Hacker groups are more organized than ever. They replacing the lone wolf hacker as the dominant sorts of cyber threats. Now, this leads to more sophisticated attacks which require more complex security defenses. According to a study from IBM and the Ponemon Institute, breaches in the U.S. healthcare field cost $6.2 billion each year, while the average cost of a single data breach across all industries is $4 million. This shows that healthcare is a clear target. And again, bringing back the WannaCry ransomware attack, the map on the bottom left-hand side of the screen shows all of the victims of that WannaCry virus, or malware rather. So I want to circle back to the WannaCry ransomware that we discussed earlier on in the webinar. You can't react to a threat if you don't know it exists, right? That's why it's important to build trust with your vendors through openness and transparency. When a weakness or cyber threat is detected, you need to know. Your security technology vendors should be fully transparent in their communication and inform you of the threats as soon as they're identified. They should issue timely corrections and patches so that you can close down said threats and get back to being secure. Here's an example of what your security technology vendor should have done after the WannaCry event. Following the attack that impacted over 150 countries, they should have ran an exhaustive risk assessment to see if their products could be affected by the malware. Within 24 hours, they should have sent a notification to their customers and channel partners. Then they should have issued hot fixes and hardware hardening tools for systems that could potentially be at risk. Now, it's more important for your vendors to be open and transparent about a possible vulnerability rather than to sweep it under the rug for fears of bad press. But improving your resilience is not just the security vendor's sole responsibility. It's a shared responsibility between system vendors, healthcare providers, consultants, and etc. So here are some questions you should be asking yourself to protect yourself. Or these are rather questions you should ask your vendor to protect yourself. Or even challenge existing partners to ensure that you could continue a viable, trusted relationship with them. So your physical security system is as secure as its weakest point or the least trusted device on the network. It's that simple. So the first question is, how transparent are vendors with cyber vulnerabilities? Full transparency provides customers with confidence and demonstrates that, that the company is acting responsibly. In the event of a security breach or cyber vulnerability, do you trust that vendor will disclose the breach as soon as possible, or do you think they'll try to conceal it for months, giving attackers time to exploit on these vulnerabilities? The second question is, do vendors have a comprehensive strategy in place to close these security gaps and vulnerabilities? Proactively monitoring the market and potential threat actors is crucial, as security gaps create an information security risk, which can lead to data loss, breaches, and violations of privacy laws. What comprehensive strategy do you have in place to manage these risks? The third question is, do vendors prioritize security in the development of their products? Companies that are committed to cybersecurity best practices build in security at every step of the development process. Are vendors building systems that are resilient and capable of withstanding multiple failures? Do they perform regular third-party auditing and penetration tests? Fourth, too often end users must discover and report liabilities because the device manufacturer does not take that responsibility on. Not doing your due diligence when choosing security solutions, or simply disregarding the fact that some of the equipment is unsafe, could result in lawsuits and fines and reputational damage. Now, will your organization take the blame for choosing to partner with an untrustworthy vendor? And who owns the manufacturing company that builds their software and hardware? Foreign government-owned vendors are known to participate in cybercriminal activities using backdoor vulnerabilities to gain cutting-edge technology and know-how at the buyer's expense. And these vendors can tap into your devices at any point in time to execute denial of service attacks or on third parties, or more troublingly, they could use your IT cameras to act as a convenient gateway into your private network. Are you willing to take on that risk? So here are our recommendations. First things first, employee education and following IT best practices. It's not only about security systems, but also how we use and deploy them. Following simple best practices in terms of cybersecurity and IT is key, and your vendor should support you in doing this. This can be as simple as maintaining a complete inventory of assets, changing default passwords, and keeping software and hardware up to date. Choosing the right partners. It's not only about government ownership, questionable business models and partnerships or identified vulnerabilities, but a mix of everything. People need to ask the right questions when evaluating manufacturers. Choose security vendors that can be relied on and that won't create a breach in your security network. This may very well be unintentional and simply because they do not put the right levels of effort into cybersecurity, but that doesn't make them more trustworthy. We need to build a network of trust between customers, manufacturers, integrators, and consultants. New regulations and compliance requirements are defining the way we develop and use information systems, and these standards are quite different from one region to another. But one thing is for sure, they are quickly evolving and being put in place, and non-compliance will cost more and more as governments are starting to realize that they need to do something to protect their citizens in this digital world. And finally, invest in cybersecurity now to prevent important costs and liability in the future. There is no single layer of protection that will fully protect your system. We recommend multiple layers of protection, and those layers need to evolve with time as new threats arise, and you need to choose the right partner. And another important component to improve your resilience is to protect the privacy of patients and staff. So you should be able to maintain the privacy of individuals within view of surveillance cameras. Here, you automatically detects individuals anonymous in live and recorded video by first detecting individuals, then blurring or masking them as they move throughout a scene. It can be used for indoor and outdoor use in confined and public areas. So here, that video that we saw will have one view that is masked in real time, and the other view, as long as the operator has the valid credentials and privileges, can view the unmasked version. This is great for the ability to install cameras in an area where privacy is typically challenged. So the last topic that I'd like to discuss before bringing the webinar into a close is about the movement of patients and employees. So a key determinant of everything that matters when it comes to health interventions, the experience, the costs, and results has been hiding in plain sight. It's the buildings and spaces in which patients are treated. The size and layout of a room, whether a bed sits in the middle or against the wall, how much space is maintained for patients to walk versus how many beds or operating equipments can be accommodated, have not really been considered predictors of health outcomes in the past. But that's changing as planning, design, and construction teams are more and more conscious of how their healthcare layouts can impact the health and well-being of patients. Also, changes in insurance coverage affect the utilization of hospital spaces. But again, how do planning, design, and construction teams improve their healthcare based on actual utilization? And ultimately, every healthcare facility strives to create a warm and inviting environment, but that's also secure and resilient. So which data sources are planning, designing, and construction teams planning on tapping into in order to guide their planning? So what if there was a way to measure how patients and staff interact with spaces in your healthcare facility? How would you use that information to guide future planning, design, and construction teams? Here's an example of a common operating picture that shows area occupancy based on people counting analytics by a top-down camera that shows how many people pass a tripwire. That then displays the insight in real time based on the individual's preferences. So the operator that logs in would be able to visualize this data as it's more important to that specific operator. We'd also see the occupancy of parking lots to see out of the 200 spaces that are available in, say, this core parking lot, there's 122 that represents a 61% utilization. And then report on that data to see how space is allocated and how to right-size the real estate that we have available for parkers. Here's another top-down view of an occupancy of individuals in an area based on access control reads in and reads out. So as cardholders badge into specific areas, we're counting the area presence of these individuals. You can ultimately drill down to specific doors or to specific rooms rather to see how real estate is being used. And this information can guide construction decisions. So in summary, is your security system equipped for your changing business? Given that the population is aging, is that overwhelming staff? And how do you plan on adapting given this increase in patient turnover? And as the threat landscape continues to evolve, is your security system up for the challenge? And with the changing utilization environment, are you tapping into the right systems in order to guide planning? So in summary, if there are key takeaways from today's presentation, it's that traditional security systems solve traditional problems and that your security team could play a broader role in reducing staff levels by reducing false alarms, improving patient safety and compliance, and that we could help you with the security technology needed to improve overall healthcare quality. If you'd like help building your vision to protect the patient experience, please reach out to these guys here. Greg Kemper is the commercial head at Genetec with a key focus on healthcare. Tom Morgan is the Director of Business Development for Healthcare at ASSA ABLOY. Their contact details are available here in the slides, and that will be distributed to all attendees.